Hey there, future nurses. Welcome back to part 7 of our series, where we're diving deep into the 4,500 most commonly repeated NCLEX questions. If you're prepping for the NCLEX, you're in the right place because in this series, we break down the questions that have been showing up over and over again on the NCLEX for the last 5 years. These are the real must-know questions shared by students who've passed the exam and are now RNs. Let's go. This Addison's disease-related question has been asked 5 times in the last 5 years and has a high likelihood of appearing in your exam. A nurse is caring for a client with Addison's disease. Which of the following statements made by the client should prompt the nurse to follow up? A. I started using table salt instead of salt substitutes. B. I joined a gym to train for an upcoming marathon. C. I recently started wearing a Medic Alert bracelet. D. If I start to feel ill, I should call my doctor right away. The correct answer is B. I joined a gym to train for an upcoming marathon. B is correct. Addison's disease involves an insufficiency of adrenal hormones, meaning the body is less capable of handling physical stress, such as strenuous exercise. Training for a marathon would increase the body's demand for steroids, and if the client doesn't adjust their steroid dosage, it could lead to an adrenal crisis. This requires careful follow-up to ensure that the client's medication regimen is appropriate for their increased physical activity level. A is incorrect because clients with Addison's disease often need to increase their salt intake to avoid hyponatremia, as their bodies don't retain sodium as well. C is incorrect because wearing a Medic Alert bracelet is highly recommended for individuals with Addison's disease. D is incorrect because it is appropriate for clients with Addison's disease to notify their doctor if they feel unwell, as illness can precipitate an adrenal crisis. This blood transfusion-related question has been asked 6 times in the last 5 years and is a common topic on exams. The nurse is preparing a continuing education session on blood transfusion reactions. Which of the following actions would be most effective in preventing an ABO incompatibility transfusion reaction? A. Prime the Y tubing set with 0.9% sodium chloride, normal saline. B. Ensure the client has a 20-gauge intravenous access device. C. Label the client's blood sample accurately for cross-matching. D. Review the client's medication allergies before the transfusion. The correct answer is C. Label the client's blood sample accurately for cross-matching. C is correct. ABO incompatibility reactions are among the most serious transfusion errors, often resulting from mislabeled blood specimens or improper cross-matching. Ensuring that the blood sample for cross-matching is correctly labeled and the client's identification is verified before the transfusion is crucial for avoiding such errors. AM is incorrect because while using normal saline to prime the Y tubing is necessary for blood transfusion, it doesn't directly prevent ABO incompatibility. B is incorrect because having appropriate intravenous access is important for safe blood delivery, but it doesn't prevent a mismatch between the client's blood type and the transfused product. D is incorrect because reviewing allergies prevents allergic reactions, but this does not affect ABO compatibility. This spinal cord injury-related question has been asked 4 times in the last 5 years, making it moderately likely to appear on your exam. A 28-year-old woman arrives in the trauma bay after being shot in the upper back. She can move the left side of her body, but not the right, and she is unable to feel pain on the left side. What type of spinal cord injury do these symptoms suggest? A. Incomplete spinal cord injury, central cord syndrome. B. Incomplete spinal cord injury, Brown-Séquard syndrome. C. Complete spinal cord injury, paraplegia. D. Incomplete spinal cord injury, anterior cord syndrome. The correct answer is B. Incomplete spinal cord injury, Brown-Séquard syndrome. B is correct. The client's symptoms of weakness on one side, right, and loss of pain sensation on the opposite side, left, are classic signs of Brown-Séquard syndrome, a form of incomplete spinal cord injury. This syndrome results from damage to one half of the spinal cord, causing motor loss on the same side as the injury, ipsilateral, and sensory loss on the opposite side, contralateral. A is incorrect because central cord syndrome typically affects the arms more than the legs and is caused by damage to the center of the spinal cord. C is incorrect because complete spinal cord injury results in total paralysis and loss of sensation below the level of injury, which is not the case in this scenario. D is incorrect because anterior cord syndrome causes loss of motor function and pain, temperature sensation, but spares touch and proprioception. This sepsis management question has been asked 7 times in the last 5 years, making it a key focus for your exam preparation. A client with severe sepsis is admitted to the critical care unit. Which intervention should be the nurse's top priority during the initial management of sepsis? A. Administer broad-spectrum antibiotics. B. Initiate invasive hemodynamic monitoring. C. Administer pain relief medications. D. Administer corticosteroids. The correct answer is A. Administer broad-spectrum antibiotics. A is correct because sepsis is a life-threatening condition that requires rapid intervention to control the underlying infection. Administering broad-spectrum antibiotics as soon as possible is crucial to reduce mortality rates. B is incorrect because invasive monitoring may be necessary later, but it is not the most urgent action during initial sepsis management. C is incorrect because pain management, while important, takes lower priority than administering antibiotics to control the infection. D is incorrect because corticosteroids are used in specific cases of septic shock, not in initial sepsis management. This toddler itching-related question has been asked 5 times in the last 5 years and is likely to reappear on your exam. Parents report that their toddler has difficulty sleeping, with intense itching around the anal area, especially at night. The nurse recognizes that these symptoms are most suggestive. Of which condition? A. Anal fissure. B. Enterobiasis, pinworm infection. C. Giardiasis. D. Celiac disease. The correct answer is B. Enterobiasis, pinworm infection. B is correct because enterobiasis, pinworm infection, is common in young children and is characterized by perianal itching, especially at night when the female worms lay their eggs around the anus. A is incorrect because anal fissures cause pain with defecation, not intense nighttime itching. C is incorrect because giardiasis causes gastrointestinal symptoms, but not perianal itching. D is incorrect because celiac disease is associated with gluten intolerance, not perianal itching. This labor induction question has been asked 6 times in the last 5 years and is likely to be seen in your exam. A nurse is caring for a client receiving intravenous oxytocin for labor induction. The nurse notices that the client's uterus has been contracting continuously for 5 minutes, and the fetal heart rate is 95 beats per minute. What should the nurse do first? A. Place the client in a Trendelenburg position. B. Stop the oxytocin infusion. C. Administer oxygen via face mask. D. Increase the IV fluid rate. The correct answer is B. Stop the oxytocin infusion. B is correct because continuous uterine contractions lasting more than 2 minutes, uterine tachysystole, can compromise fetal oxygenation. The first action is to stop the oxytocin infusion. A is incorrect because the Trendelenburg position is not appropriate in this case. Lateral positioning would improve circulation. C is incorrect because oxygen administration may be helpful, but stopping the oxytocin is the priority. D is incorrect because increasing IV fluids would not directly address the overstimulation caused by oxytocin. This metabolic alkalosis-related question has been asked 5 times in the last 5 years and is a commonly tested topic. The nurse is teaching nursing students about conditions that can lead to metabolic alkalosis. Which condition would indicate a correct understanding if mentioned by a student? A. Hyperventilation. B. Urinary retention. C. Opioid overdose. D. Excessive vomiting. The correct answer is D. Excessive vomiting. D is correct because excessive vomiting leads to a loss of gastric acid, resulting in metabolic alkalosis. A is incorrect because hyperventilation leads to respiratory alkalosis, not metabolic alkalosis. B is incorrect because urinary retention is not typically associated with metabolic alkalosis. C is incorrect because opioid overdose leads to respiratory acidosis, not metabolic alkalosis. This retinal detachment-related question has been asked 4 times in the last 5 years. A client is suspected of having retinal detachment. Which of the following symptoms is not consistent with this diagnosis? A. Seeing floaters in the visual field. B. A sensation of a curtain coming down over the eyes. C. Flashes of light in the vision. D. Intense pain in the affected eye. The correct answer is D. Intense pain in the affected eye. D is correct because retinal detachment typically presents with visual disturbances like floaters or flashes of light, but it is usually painless. Intense pain is more characteristic of conditions like acute angle closure glaucoma. A is incorrect because seeing floaters is a common symptom of retinal detachment. B is incorrect because the sensation of a curtain being drawn over the visual field is a classic symptom of retinal detachment. C is incorrect because flashes of light are a common symptom of retinal detachment. This preeclampsia-related question has been asked 5 times in the last 5 years. A nurse is assessing a client suspected of having preeclampsia. Which question would be most appropriate to ask to assess for this condition? A. Does bright light bother your eyes? B. Have you been experiencing back pain? C. Are you having any vaginal discharge? D. Are your gums bleeding more than usual? The correct answer is A. Does bright light bother your eyes? A is correct because photophobia, sensitivity to light, is a common symptom of preeclampsia, often accompanying severe headaches. B is incorrect because back pain is not specific to preeclampsia. C is incorrect because vaginal discharge is not a symptom of preeclampsia. D is incorrect because gum bleeding is related to hormonal changes in pregnancy, but is not a symptom of preeclampsia. Let's move to the next question. This risperidone-related question has been asked 6 times in the last 5 years, making it likely to reappear on your exam. A nurse is educating a client about their new prescription for risperidone. Which of the following client statements should prompt further clarification? A. I will notify my doctor if I develop unusual movements. B. I'll need to get weekly blood tests to check my white blood cells. C. If my muscles become stiff, I should inform my doctor. D. I'll use sugarless gum to help if my mouth gets dry. The correct answer is B. I'll need to get weekly blood tests to check my white blood cells. B is correct. Although risperidone is a second-generation antipsychotic, often prescribed for conditions like schizophrenia or delirium, weekly monitoring of white blood cell counts is not required. This practice is generally associated with clozapine, a different antipsychotic that has a specific risk of a granulocytosis. A is incorrect. Clients on risperidone should be vigilant for any abnormal movements, such as dystonia or tardive dyskinesia, and report them to their healthcare provider. Movement disorders are a known side effect of this medication. C is incorrect. Muscle stiffness can be an early sign of neuroleptic malignant syndrome, NMS, a serious complication of antipsychotic medications. Immediate reporting is necessary for prompt intervention. D is incorrect. Dry mouth is a common anticholinergic side effect of risperidone, and using sugar-free gum or special mouthwash is a recommended strategy to manage this symptom. Let's move on to the next question. This lab-related question has been asked 4 times over the last 5 years, and it may appear again on the exam. A nurse is reviewing the following lab results for a patient and considering which early vital sign change would likely occur based on these results. A. Increased heart rate. B. Decreased heart rate. C. Lowered blood pressure. D. Slowed breathing rate. The correct answer is A. Increased heart rate. A is correct. The patient's lab results indicate critically low hemoglobin and hematocrit levels, which can signal hypovolemia. The body compensates for the reduced oxygen carrying capacity by increasing the heart rate, tachycardia, to maintain tissue oxygenation, making this the earliest sign of hypovolemic shock. B, C, and D are incorrect. While hypotension, low blood pressure, may develop as hypovolemic shock progresses, it is not an early sign. Bradypnea, slowed breathing, and bradycardia, slowed heart rate, typically occur later in shock, making them less likely early indicators in this context. Let's continue with the next question. This psychotherapy-related question has been asked 5 times over the last 5 years and is likely to come up again. Which form of psychotherapy is most likely to be effective for a group of clients dealing with phobias? A. Behavioral therapy. B. Cognitive behavioral therapy. C. Psychoanalytic therapy. D. Cognitive therapy. The correct answer is B. Cognitive behavioral therapy. B is correct. Cognitive behavioral therapy, CBT, combines behavioral strategies and cognitive restructuring, which is highly effective for treating phobias. The behavioral aspect of CBT often involves exposure therapy, where the client is gradually exposed to the feared object or situation, helping them overcome their fear. The cognitive component helps clients identify and change irrational beliefs that contribute to their phobia. A is incorrect. While behavioral therapy can be useful for various conditions, including addiction and some anxiety disorders, CBT is more targeted for phobias due to its dual approach of addressing both behavior and thought patterns. C is incorrect. Psychoanalysis is focused on exploring unconscious thoughts and past experiences. It is not typically used for phobia treatment, as it doesn't involve the structured exposure and thought restructuring needed to address specific fears. D is incorrect. Cognitive therapy focuses on changing thought patterns, but lacks the behavioral strategies, such as exposure therapy, which are critical in the treatment of phobias. Let's move to the next question. This anti-tubercular medication question has been asked 7 times in the last 5 years and may be seen on the exam. A nurse is discharging a patient who has been prescribed antitubercular medications for pulmonary tuberculosis. The nurse is most concerned about the possibility of an adverse reaction if the patient A. Lives with others and works in a public-facing job. B. Uses oral contraceptives. C. Smokes a pack of cigarettes daily. D. Drinks several glasses of wine each day. The correct answer is D. Drinks several glasses of wine each day. D is correct. Antitubercular drugs, such as isoniazid, rifampicin, and pyrazinamide, are known to be hepatotoxic. A patient who consumes alcohol is at a heightened risk for liver damage while taking these medications. The nurse should strongly advise the patient to avoid alcohol during treatment. A is incorrect. Although close contact with others may increase the risk of transmission, this does not increase the risk of adverse reactions from the medication. B is incorrect. Oral contraceptives are safe to use with antitubercular medications. In fact, contraception may be important to prevent pregnancy due to the potential teratogenic effects of some antitubercular drugs. C is incorrect. Smoking increases the risk for lung and other cancers, but does not specifically increase the risk of medication-related liver damage from antitubercular drugs. Let's proceed to the next question. This question about Rho-D immune globulin has been asked 8 times and is one of the board's favorites. A group of nursing students is being counseled on the appropriate administration of Rho-D immune globulin. A student demonstrates understanding if they state that the medication should be given. A. At 12 weeks of pregnancy, and again within 72 hours of giving birth. B. At 28 weeks of pregnancy, and again within 72 hours of delivery. C. At 25 weeks of pregnancy, and again within 96 hours after birth. D. At 16 weeks of pregnancy and within 12 hours of giving birth. The correct answer is B, at 28 weeks of pregnancy, and again within 72 hours of delivery. B is correct. Rho-D immune globulin is typically administered around 28 weeks of gestation and again within 72 hours after delivery to prevent Rh sensitization in an Rh-negative mother carrying an Rh-positive fetus. This schedule is necessary to prevent maternal immune response to fetal red blood cells, which could affect future pregnancies. A, C, and D are incorrect. These timeframes are incorrect, as they do not align with the recommended guidelines for preventing Rh isoimmunization. Administering Rho-D. Immune globulin too early or too late would not provide the necessary protection. Let's move on to the next question. This cultural norms question has been asked 5 times and could appear on the exam again. A nurse is caring for a client who is Native American. Which of the following actions should the nurse take to respect the client's cultural norms? A. Limit direct eye contact. B. Ensure the healthcare provider is the same gender as the client. C. Defer healthcare decisions to the male family members. D. Provide time for meditation at a Buddhist shrine. The correct answer is A. Limit direct eye contact. A is correct. In Native American cultures, direct eye contact may be considered disrespectful or aggressive. The nurse should be aware of this cultural norm and avoid prolonged eye contact when interacting with the client. B is incorrect. Gender-specific care is not a universal requirement in Native American cultures, although it may be relevant in some other cultures. C is incorrect. Healthcare decisions in Native American communities are often made collectively, but there is no strict rule that defers decision-making to male family members. D is incorrect. Meditation in a Buddhist shrine is a practice associated with Buddhism, not Native American traditions. Let's proceed to the next question. This fall risk assessment question has been asked 6 times in the last 5 years. When assessing a home health client for fall risk, what environmental factor is most crucial to evaluate? A. Client's cognitive status. B. Presence of carpets throughout the home. C. Peripheral nerve damage. D. Sufficient lighting. The correct answer is D. Sufficient lighting. D is correct. Adequate lighting is essential in preventing falls, especially in elderly or mobility-impaired clients. Dim or poorly lit areas can increase the likelihood of tripping and falling, so ensuring well-lit spaces is a key preventative measure. A is incorrect. Cognitive impairment is an intrinsic risk factor, not an environmental one. While it may contribute to falls, it is not directly related to the home environment itself. B is incorrect. Carpets alone are not necessarily hazardous, unless they include scatter rugs that can shift or cause tripping. C is incorrect. Peripheral neuropathy affects sensation in the extremities, making it a personal health risk rather than an environmental one. Let's move to the next question. This hypothyroidism screening question has been asked 7 times and may appear again on your exam. A nurse is conducting hypothyroidism screenings at a community health fair. Which client is most at risk based on their symptoms? A. A client who is underweight, anxious, and has a rapid pulse and frequent diarrhea. B. A client who is overweight, experiences cold intolerance, and sweats while exercising. C. A client who is obese, hypertensive, and constantly thirsty. D. A client who is obese, has swelling around the eyes, and reports feeling unmotivated. The correct answer is D. A client who is obese, has swelling around the eyes, and reports feeling unmotivated. D is correct. This client presents classic signs of hypothyroidism, including obesity, periorbital edema, swelling around the eyes, and decreased motivation, avolition. These symptoms reflect the slow metabolism and fluid retention common in hypothyroid clients. A is incorrect. The symptoms described, underweight, anxiety, rapid pulse, and diarrhea, are indicative of hyperthyroidism rather than hypothyroidism. B is incorrect. While cold intolerance and overweight status may suggest hypothyroidism, sweating during exercise is normal and not associated with hypothyroid conditions. C is incorrect. Obesity and high blood pressure can be signs of metabolic syndrome, and excessive thirst suggests hyperglycemia rather than hypothyroidism. Let's proceed to the next question. This milieu therapy question has been asked 6 times in the last 5 years. A nurse is preparing a presentation on milieu therapy for a staff development conference. Which of the following points should be emphasized? A. This therapy is limited to inpatient facilities and focuses on physical well-being. B. Its primary goal is to build emotional connections with individuals in the broader community. C. The environment, structure, and emotional atmosphere are essential components for client recovery. D. It is an unstructured approach, allowing clients to determine their own boundaries. The correct answer is C. The environment, structure, and emotional atmosphere are essential components for client recovery. C is correct. Milieu therapy involves creating a structured environment that promotes safety, support, and routine. This therapeutic approach focuses on how the environment and emotional climate can aid in a client's healing process, fostering positive behavioral changes and a sense of community. A is incorrect. Milieu therapy can be used in both inpatient and outpatient settings, and it emphasizes emotional and psychological well-being as much as physical health. B is incorrect. The focus of miliotherapy is on the therapeutic environment within the treatment setting, not building external relationships with individuals outside the community. D is incorrect. Miliotherapy relies on structure and consistency, not an unstructured or self-regulated approach. Let's finish with the final question. This myelomeningocele-related question has been asked 9 times and is one of the most important to review. A newborn with a myelomeningocele requires special care to protect the exposed sac. How should the nurse ensure its protection? A. Flush the sac with cold saline solution. B. Apply petroleum jelly to the sac for protection. C. Use a moist, sterile saline dressing to cover the sac. D. Cover the sac with a dry dressing. The correct answer is C. Use a moist, sterile saline dressing to cover the sac. C is correct. To prevent the myelomeningocele sac from drying out and becoming damaged, the nurse should apply a sterile, moist saline dressing and change it frequently, every 2 to 4 hours. This keeps the sac hydrated and protects it from infection or injury until surgical repair can be done. A is incorrect. Using cold saline could cause the newborn to experience cold stress, which is not advisable. B is incorrect. Petroleum jelly can cause tissue breakdown with prolonged use and should not be applied to the sac. D is incorrect. A dry dressing can stick to the sac and cause irritation or further damage, making it an inappropriate choice for protecting the exposed tissue. This deep breathing exercise question for a pediatric patient has been asked 4 times in the last 5 years, making it likely to appear on the exam. A 7-year-old child has just undergone abdominal surgery and is feeling anxious. The nurse needs to facilitate deep breathing exercises to aid recovery. What is the most appropriate action by the nurse? A. Provide the child with instructions on how to use an incentive spirometer. B. Tell her she will get ice cream after completing the exercise. C. Give the child a pinwheel to blow on and play with her. D. Have the child play catch with the nurse using bean bags. The correct answer is C. Give the child a pinwheel to blow on and play with her. C is correct because giving a child a pinwheel to blow on not only reduces anxiety by making the activity more playful and engaging, but also promotes lung expansion, similar to an incentive spirometer. This method is especially effective for children who may struggle with understanding or cooperating with traditional medical equipment. A is incorrect because instructions on using an incentive spirometer may increase the child's anxiety and are typically given preoperatively. Postoperatively, a playful approach like using a pinwheel is more appropriate for a young child. B is incorrect because offering ice cream as a reward is a form of bribery and is not recommended as a method to encourage medical compliance. Positive reinforcement should be constructive, focusing on health benefits rather than extrinsic rewards. D is incorrect because playing catch helps improve physical strength, but does not target lung expansion, which is critical after abdominal surgery to prevent complications like atelectasis. This critical care respiratory distress scenario has been asked 6 times in the past 5 years, making it an important topic to study. A client in the intensive care unit has labored breathing, rapid breathing, altered mental status, and an arterial blood gas showing a partial pressure of oxygen of 70 millimeters of mercury. What is the nurse's priority action? Option A, intubation via an endotracheal tube. Option B, 12-lead electrocardiogram. Option C, capillary blood glucose test. Option D, insertion of an additional peripheral vascular access device. The correct answer is option A, intubation via an endotracheal tube. Option A is correct because the client's respiratory status is critically compromised, as evidenced by low partial pressure of oxygen and labored breathing. Immediate intervention with intubation and mechanical ventilation is necessary to secure the airway, improve oxygenation, and prevent further deterioration in mental status caused by low oxygen levels. Option B is incorrect because while severe low oxygen can lead to cardiac arrhythmias, the client's immediate issue is respiratory failure. Correcting oxygenation takes priority over monitoring the heart at this point. Option C is incorrect because, although altered mental status can be caused by low blood sugar, the client's respiratory distress and low partial pressure of oxygen indicate low oxygen levels as the primary cause. Blood glucose testing can be done later. Option D is incorrect because additional peripheral vascular access may be useful for administering medications or fluids. But the priority is stabilizing the client's respiratory function, which is best achieved through intubation. This question about psychosocial development stages has been asked 5 times in the last 5 years, making it a frequently tested topic. A nurse is caring for a 4-year-old child. Based on Erikson's stages of psychosocial development, which stage is the child in? A. Initiative versus guilt. B. Autonomy versus shame and doubt. C. Industry versus inferiority. D. Trust versus mistrust. The correct answer is A. Initiative versus guilt. A is correct because, according to Erikson, children aged 3 to 5 years are in the initiative versus guilt stage. At this age, children begin to assert control and power over their environment. Success in this stage leads to a sense of initiative, while failure results in feelings of guilt about their desires and goals. B is incorrect because autonomy versus shame and doubt is the developmental stage for children aged 2 to 3 years, focusing on developing independence. This is not applicable for a 4-year-old child. C is incorrect because industry versus inferiority is relevant for school-age children 6 to 11 years who are focused on mastering social and academic skills. This stage comes later than the preschool years. D is incorrect because trust versus mistrust is the stage for infants from birth to 18 months, where the child learns whether or not they can trust caregivers based on the reliability and care they receive. This chest tube management question has been asked 4 times in the last 5 years, making it a moderately frequent exam topic. A client with a pneumothorax is attached to a chest tube system with wall suction. Which of the following findings requires further assessment? A. Continuous bubbling in the suction control chamber. B. Continuous bubbling in the water seal chamber. C. Drainage of 50 milliliters of serosanguinous fluid in the first hour after chest tube insertion. D. Absence of drainage in the collection chamber. The correct answer is B. Continuous bubbling in the water seal chamber. B is correct because continuous bubbling in the water seal chamber indicates an air leak, which is abnormal. Titling and intermittent bubbling are expected, especially in a client with a pneumothorax. The nurse should investigate to identify and correct the source of the air leak. A is incorrect because continuous bubbling in the suction control chamber is normal when wall suction is being applied. This confirms that the suction is functioning properly. C is incorrect because drainage of 50 milliliters of serosanguinous fluid in the first hour after chest tube insertion is within the normal range, especially following the initial placement of the tube. No further action is required for this finding. D is incorrect because the absence of drainage could indicate that the lung has re-expanded or that there is minimal fluid production. This is not necessarily a sign of malfunction unless accompanied by other signs of respiratory distress. This post-stroke emergency management scenario has been asked 7 times in the last 5 years, making it a high priority question. A post-stroke client suddenly develops a fixed and dilated pupil. What is the nurse's most appropriate action? A. Reduce environmental stimuli. B. Reassess after 10 minutes. C. Check the client's blood pressure. D. Notify the physician immediately. The correct answer is D. Notify the physician immediately. D is correct because a new onset of a fixed and dilated pupil after a stroke may indicate dangerously increased intracranial pressure, ICP, potentially signaling cerebral herniation. This is a medical emergency that requires immediate intervention, so the nurse must notify the physician without delay to prevent further neurological damage or death. A is incorrect because reducing environmental stimuli is useful for managing agitation or sensory overload, but will not address the underlying cause of increased ICP. B is incorrect because waiting to reassess the pupil in 10 minutes is inappropriate in this situation. Immediate action is required to prevent further complications. C is incorrect because, while checking the client's blood pressure is important in cases of increased ICP, the first priority is to alert the physician for urgent management of the ICP. This anatomical location question related to McBurney's point has been asked 5 times in the past 5 years, making it a common board favorite. Which region of the abdomen is known as McBurney's point? A. Region AA, B. Region B, C. Region C, D. Region DUS. The correct answer is C. Region C. C is correct because McBurney's point is located in the right lower quadrant, RLQ, of the abdomen, and tenderness in this area is a key sign of appendicitis. It lies between the umbilicus and the anterior superior iliac spine. A is incorrect because region A refers to the right upper quadrant, RUQ, where liver-related issues are typically evaluated. B is incorrect because region B is the left upper quadrant, LUQ, the area where the spleen is located. D is incorrect because region D refers to the left lower quadrant, LLQ, where issues such as diverticulitis may be assessed, not appendicitis. This emergency triage scenario has been asked 5 times in the last 5 years, making it a common topic in exams. The nurse is triaging clients involved in a bus accident. Which client should be prioritized for transport to a trauma center? A. Has pain and swelling in the right forearm with an intact distal pulse. B. Has profuse bleeding from a chest wound and is experiencing apnea. C. Has a crushed leg with no sensation and no distal pulse. D. Is anxious with abrasions on both arms. The correct answer is C. Has a crushed leg with no sensation and no distal pulse. C is correct because this client is experiencing a significant compromise in circulation, no distal pulse or sensation, which could lead to ischemia and loss of the limb. This warrants a red tag in emergency triage, meaning they require immediate care and transport to the trauma center. A is incorrect because the client with forearm pain and swelling, but an intact pulse and sensation, can be classified as a green tag, delayed care. This injury is not life-threatening. B is incorrect because a client with apnea and profuse bleeding would be black tagged, indicating that death is imminent or the injury is not survivable with current resources. D is incorrect because the client with anxiety and minor abrasions can be classified as a green tag. There is no life-threatening injury. This magnesium toxicity management scenario has been asked 6 times in the last 5 years, making it an important nursing topic. A client receiving intravenous magnesium for a low magnesium level reports facial flushing midway through the infusion. What is the priority nursing action? A. Slow down the infusion rate. B. Notify the primary healthcare provider. C. Reassess the client after the infusion. D. Stop the infusion immediately. The correct answer is D. Stop the infusion immediately. D is correct because facial flushing can be an early sign of magnesium toxicity. The nurse's immediate action should be to stop the infusion to prevent further magnesium administration and potential complications like arrhythmias or respiratory depression. AI is incorrect because slowing the infusion rate is not appropriate if the client is showing signs of possible toxicity. Stopping the infusion takes priority. B is incorrect because while notifying the provider is important, the priority is to stop the infusion to prevent further adverse effects. C is incorrect because reassessing the client later is not an adequate response when signs of toxicity are present. Immediate intervention is necessary. Let's move to the next question. This respiratory assessment question has been asked 8 times in the last 5 years, so it's highly probable that it may appear in your exam. A nurse is caring for a 76-year-old patient with pneumonia. What is the most important nursing assessment? A. Ensure the patient's airway is open and clear. B. Evaluate the sounds produced by chest percussion. C. Listen to the patient's lung fields for breath sounds. D. Monitor the patient's breathing rate. The correct answer is A. Ensure the patient's airway is open and clear. A is correct. In elderly patients, reduced mobility can lead to airway complications, making airway patency a priority. Decreased cough reflex and weakened respiratory muscles increase the risk for airway obstruction, hypoxia, and pneumonia-related complications like hypercapnia and acidosis. Maintaining an open airway is critical to ensure proper gas exchange and prevent further respiratory distress. B is incorrect. Although percussion can help assess lung consolidation, it does not take precedence over ensuring the patient's airway is clear. C is incorrect. Listening to breath sounds is valuable for identifying areas of abnormal air movement, but it comes after ensuring that the patient has a patent airway. D is incorrect. While respiratory rate monitoring is important for evaluating breathing effort, it is a secondary assessment compared to ensuring the airway is open and functioning. Let's move on to the next question. This anxiety management question has been asked 7 times in the last 5 years and is highly likely to reappear on the exam. A patient with an anxiety disorder suddenly experiences an acute panic attack in a crowded mental health clinic. Which intervention should the nurse initiate first? A. Administer a prescribed dose of alprazolam right away. B. Engage the patient in a discussion about their emotional state. C. Guide the patient to a private, quiet room to help them calm down. D. Take the patient's vital signs immediately. The correct answer is C. Guide the patient to a private, quiet room to help them calm down. C is correct. The first step is to reduce the patient's exposure to environmental stressors. Escorting them to a quiet and calm space can help reduce anxiety and allow the patient to regain control over their emotional state. A is incorrect. Medication administration, such as alprazolam, requires a healthcare provider's order and does not address the immediate need to remove the patient from the triggering environment. Also, the effects of oral alprazolam would take time to occur. B is incorrect. During a panic attack, the patient is likely too overwhelmed to articulate their feelings clearly, so this approach is better suited for later stages of anxiety management. D is incorrect. Vital signs should be assessed after the patient is in a calm environment as anxiety will cause elevated readings, giving inaccurate data. Let's continue to the next question. This psychiatric assessment question has been asked 6 times in the last 5 years, making it a moderately important topic for the exam. A nurse is assessing a patient with schizophrenia who seems to be using neologisms during their speech. What would the nurse expect to find? A. The patient's speech includes words that rhyme or start similarly. B. The patient speaks in short, minimal responses. C. The patient invents new words or phrases that only have meaning to them. D. The patient goes off topic and never returns to the point. The correct answer is C. The patient invents new words or phrases that only have meaning to them. C is correct. Neologisms are words or phrases that a person with schizophrenia invents, which hold meaning only for them. This is a positive symptom of schizophrenia and reflects disorganized thinking. A is incorrect. Rhyming or using similar sounding words is referred to as clang associations, not neologisms. B is incorrect. Short or minimal speech is called alogia, a negative symptom of schizophrenia, which differs from the creation of new words. D is incorrect. Tangential speech, where the person goes off on unrelated topics and never circles back, is a different manifestation of thought disorder than neologisms. Let's move forward to the next question. This electrolyte imbalance question has been asked 5 times in the last 5 years, giving it a good chance of reappearing in the exam. A patient has a serum potassium level of 3.3 MEQL. What is the nurse's priority action? A. Educate the patient about eating potassium-rich foods. B. Begin continuous heart monitoring, telemetry. C. Obtain an order for calcium gluconate. D. Perform a detailed neurological assessment. The correct answer is B. Begin continuous heart monitoring, telemetry. B is correct. Hypokalemia can cause serious cardiac arrhythmias, so continuous telemetry monitoring is essential to detect early signs of heart rhythm disturbances. Ensuring cardiac monitoring is the highest priority in the management of hypokalemia. A is incorrect. While teaching the patient about potassium-rich foods is important for long-term management, it does not address the immediate concern of potentially dangerous heart rhythms. C is incorrect. Calcium gluconate is used to stabilize the heart in cases of hyperkalemia, not hypokalemia. D is incorrect. Neurological issues related to low potassium are secondary to cardiac concerns, which must be addressed first. Let's move on to the next question. This geriatric assessment question has been asked 4 times in the last 5 years, making it moderately likely to appear on the exam. When assessing the health history of an elderly patient, which factors should the nurse focus on? A. Birth history, vaccinations, and childhood development. B. History of pregnancies, childbirth, and mental health. C. Spiritual beliefs, cultural practices, and personal values. D. Sensory impairments, past illnesses, and lifestyle habits. The correct answer is D. Sensory impairments, past illnesses, and lifestyle habits. D is correct. As individuals age, they are more likely to experience sensory deficits, such as vision or hearing loss, and multiple chronic illnesses. Assessing lifestyle choices, such as diet, exercise, and tobacco use, can provide insight into potential health risks and complications. This is critical when formulating an effective care plan for older adults. A is incorrect. Birth history and childhood development are more relevant for pediatric patients. B is incorrect. Obstetric history is important for women of childbearing age, but is less relevant for older adults. C is incorrect. While spirituality and cultural factors are part of a holistic assessment, They are not the primary focus when gathering a health history for an elderly patient. Let's continue with the next question. This electrolyte imbalance question has been asked 7 times in the last 5 years and is quite likely to appear in the exam. The nurse is caring for a patient who experienced a subarachnoid hemorrhage. What electrolyte imbalance is the patient at risk for developing? A. Elevated potassium levels, hyperkalemia. B. Low calcium levels, hypocalcemia. C. Low sodium levels, hyponatremia. D. Elevated magnesium levels, hypermagnesemia. The correct answer is C. Low sodium levels, hyponatremia. C is correct. Hyponatremia is a common complication following a subarachnoid hemorrhage, often due to the syndrome of inappropriate antidiuretic hormone, CAADH, or cerebral salt wasting syndrome. Both conditions cause low sodium levels and require careful monitoring and management to prevent neurological complications. A is incorrect. Hyperkalemia is not a typical complication of subarachnoid hemorrhage and is more commonly seen in conditions affecting the adrenal glands. B is incorrect. Hypocalcemia is not related to subarachnoid hemorrhage. It is associated with conditions like hypoparathyroidism. D is incorrect. Hypermagnesemia is not a common complication of subarachnoid hemorrhage. Let's proceed with the next question. This gynecological procedure question has been asked 5 times in the last 5 years, making it a common topic for exams. The nurse is preparing a patient for a vaginal and cervical colposcopy with a biopsy. What information should the nurse provide? A. Avoid eating or drinking for 8 hours before the test. B. Arrange for someone to drive you home afterward. C. Expect to experience a metallic taste due to contrast dye. D. Vaginal intercourse may be uncomfortable after the procedure. The correct answer is D. Vaginal intercourse may be uncomfortable after the procedure. D is correct. After a colposcopy with biopsy, vaginal discomfort is common, especially during intercourse. The nurse should advise the patient to avoid sexual activity for at least 48 hours and to expect some discomfort afterward. A is incorrect. Fasting is not required before a colposcopy, as it does not involve sedation or anesthesia. B is incorrect. The procedure does not require sedation, so the patient can drive themselves home unless otherwise advised. C is incorrect. No contrast dye is used during a colposcopy, so the patient will not experience a metallic taste. Let's move forward to the next question. This diagnostic assessment question has been asked 6 times in the last 5 years, making it a likely candidate for the exam. The nurse is checking the pH of gastric fluid obtained from a nasogastric NG tube to confirm proper placement. What pH value would indicate correct placement in the stomach? A. pH of 3.4. B. pH of 7. C. pH of 5.9. D. pH of 8. The correct answer is A. pH of 3.4. A is correct. A pH of less than 5.5 suggests that the NG tube is correctly placed in the stomach where the gastric environment is acidic. Verifying placement through pH measurement is essential to prevent accidental administration of medications or feedings into the lungs. B is incorrect. A pH of 7 is neutral and suggests the tube may be in the respiratory tract, not the stomach. C is incorrect. A pH of 5.9 is slightly higher than expected for gastric contents, so further verification may be needed. D is incorrect. A pH of 8 indicates alkalinity, which suggests the NG tube may be in the small intestine or the respiratory tract. Let's continue with the next question. This chest tube insertion question has been asked 8 times in the last 5 years and is very likely to appear in the exam. The nurse assists the physician with inserting a chest tube for a patient with a pneumothorax. What finding suggests that the chest tube insertion was successful? A. The chest X-ray shows consolidation in the lungs. B. Clear breath sounds are heard on both sides of the chest. C. There is rapid bubbling in the chest tube's suction chamber. D. Subcutaneous air, crepitus, is felt at the insertion site. The correct answer is B. Clear breath sounds are heard on both sides of the chest. B is correct. The presence of clear and equal breath sounds on both sides indicates that the lung has re-expanded following the chest tube insertion, which is the goal of treating a pneumothorax. A is incorrect. Consolidation in the lungs suggests fluid or infection, not successful lung re-expansion. C is incorrect. Rapid bubbling in the suction chamber can indicate an air leak, which is a complication, not a sign of effective treatment. D is incorrect. Crepitus, or subcutaneous air, indicates air escaping into the tissue, which is a complication rather than a successful outcome. Let's proceed to the next question. This medication monitoring question has been asked 5 times in the last 5 years, making it a moderately important exam topic. A patient is prescribed desmopressin for diabetes insipidus. What laboratory value should the nurse monitor closely? A. Sodium levels in the blood. B. Blood sugar levels. C. Magnesium levels. D. Calcium levels. The correct answer is A. Sodium levels in the blood. A is correct. Desmopressin increases water retention, which can dilute sodium levels and lead to hyponatremia. Close monitoring of serum sodium is critical to avoid dangerous complications like confusion, seizures, or coma. B is incorrect. Desmopressin does not significantly affect glucose levels, so there is no need for frequent monitoring. C is incorrect. Magnesium levels are not typically affected by desmopressin treatment. D is incorrect. Desmopressin does not impact calcium levels, so monitoring calcium is unnecessary in this context. Let's move on to the final question. This postpartum hemorrhage question has been asked 9 times in the last 5 years, making it one of the most critical topics for the exam. A patient who is 6 hours postpartum reports that they have changed their peripad 4 times in the last 6 hours. What action should the nurse take? A. Record the finding as normal. B. Massage the patient's uterus. C. Evaluate the patient for signs of hemorrhage. D. Assist the patient to the restroom to empty their bladder. The correct answer is C. Evaluate the patient for signs of hemorrhage. C is correct. Changing the peripad more frequently than once every 2 hours may indicate postpartum hemorrhage. The nurse should immediately assess the patient for excessive bleeding and other signs of hemorrhage to ensure prompt intervention if necessary. A is incorrect. Changing a pad this often is not normal and should not be documented as such without further investigation. B is incorrect. Uterine massage is appropriate if hemorrhage is confirmed, but assessment for hemorrhage must occur first. D is incorrect. While emptying the bladder can help with uterine contraction, the priority here is to assess for potential hemorrhage before focusing on bladder emptying. This hypothermia-related question has been asked 6 times in the last 5 years, and there is a strong possibility it will be asked again in your exam. A client is brought to the emergency department after being found confused, lying on the ground, and covered with snow. The nurse notes a core temperature of 88 degrees Fahrenheit, which is equivalent to 31.1 degrees Celsius, respirations of 16 per minute, pulse of 63 per minute, and blood pressure of 108 over 71 millimeters of mercury. What condition is the client most likely experiencing? Option A, mild hypothermia. Option B, moderate hypothermia. Option C, severe hypothermia. Option D, frostbite. The correct answer is option B, moderate hypothermia. Option B is correct. Moderate hypothermia is defined as a core body temperature between 82.4 to 90 degrees Fahrenheit, which is 28 to 32 degrees Celsius. The client's temperature of 88 degrees Fahrenheit, or 31.1 degrees Celsius, falls within this range. Symptoms of moderate hypothermia include confusion, muscle weakness, and loss of coordination, all of which match the client's presentation. Option A is incorrect. Mild hypothermia occurs at a core temperature between 89.6 and 95 degrees Fahrenheit, which is 32 to 35 degrees Celsius. Clients with mild hypothermia typically present with slurred speech and decreased coordination, but this client's temperature and symptoms are more severe. Option C is incorrect. Severe hypothermia occurs at a temperature below 82.4 degrees Fahrenheit, which is 28 degrees Celsius. Clients with severe hypothermia exhibit signs such as bradycardia, severe low blood pressure, decreased respirations, and impaired reflexes, which are more extreme than what is observed in this client. Option D is incorrect. Frostbite refers to the freezing of body tissues, typically affecting extremities, and is not associated with the overall body temperature. While frostbite may accompany hypothermia, the client's core temperature indicates hypothermia as the primary concern. This cognitive distortion-related question has been asked 4 times in the last 5 years, so there's a fair chance it will appear in the exam. The nurse is interviewing a client who makes catastrophizing statements. Which of the following interventions should the nurse suggest to help address this cognitive distortion? A. Calculate real-world probabilities and focus on evidence. B. Recognize that people and events are evaluated on a continuum, not just as good or bad. C. Create and reference a log of past successes the client may have forgotten. D. Participate in diversional activities such as physical exercise or socializing. The correct answer is A. Calculate real-world probabilities and focus on evidence. A is correct. Catastrophizing involves irrational thinking, where a person expects the worst possible outcome. Helping the client to calculate realistic probabilities and focus on evidence encourages them to challenge their distorted thoughts with facts and to consider possible positive outcomes. B is incorrect. Evaluating events on a continuum is a strategy for managing dichotomous thinking, where things are viewed in extremes, such as all good or all bad. This is a different cognitive distortion than catastrophizing. C is incorrect. Using a log of past successes is helpful for addressing selective abstraction, where an individual focuses only on their failures. This is not the appropriate intervention for catastrophizing, where the focus is on predicting future negative events. D is incorrect. While diversional activities such as physical exercise can help alleviate anxiety, they do not directly address the distorted thinking involved in catastrophizing. This critical lab value question has been asked 5 times over the last 5 years, so there's a good chance it will show up again in the exam. A nurse receives a phone call from the lab regarding a critical sodium level of 122 mql. What is the nurse's first action? A. Notify the primary health care provider, PHCP. B. Implement seizure precautions. C. Read back the result to verify it. D. Recollect the laboratory specimen. The correct answer is C. Read back the result to verify it. C is correct. Before taking any further action, the nurse must read back the critical result to confirm it with the lab. This ensures that the result was communicated correctly and that no errors were made in the lab or during the communication process. Verification is crucial to prevent potential harm caused by incorrect information. A is incorrect. Notifying the PHCP is important, but should occur only after verifying the result with the lab. The nurse needs to ensure the critical value is accurate before escalating the issue. B is incorrect. While seizure precautions may be appropriate given the low sodium level, this intervention should occur after confirming the result. D is incorrect. Recollecting the specimen may be necessary if there is suspicion of lab error, but this action comes after verifying the result with the lab. The first priority is ensuring the result is accurate. This kosher meal-related question has appeared 3 times in the last 5 years, so it has a moderate chance of being tested again. A kosher meal has been delivered to a client. What should the nurse do to ensure the meal meets the client's dietary requirements? A. Withhold any liquids until after the meal. B. Assist the client in unwrapping the utensils. C. Remove any condiments such as salt and pepper. D. Allow the client to unwrap the utensils. The correct answer is D. Allow the client to unwrap the utensils. D is correct. Kosher meals are typically served on disposable plates with sealed plastic utensils, which should be unwrapped by the client to ensure adherence to religious dietary laws. The nurse should not touch the utensils or food. A is incorrect. Liquids may be served with the meal, as long as they do not contain dairy if the meal includes meat. There is no requirement to withhold liquids. B is incorrect. The nurses should not assist in unwrapping the utensils or handling the meal in any way, as this may violate kosher dietary laws. C is incorrect. Condiments such as salt and pepper are generally permitted with kosher meals, so there is no need to remove them. This accident prevention-related question has been asked 5 times over the last 5 years, making it quite likely to appear on the exam. A nurse is giving a presentation on accident prevention in school-age children. Which statement by an attendee demonstrates an understanding of the topic? A. School-age children become less adventurous compared to preschoolers. B. School-age children are safest when at home. C. School-age children understand dangers when explained to them. D. School-age children have less self-control than preschoolers. The correct answer is C. School-age children understand dangers when explained to them. C is correct. School-age children have reached a developmental stage where they can understand and apply the rationale behind safety rules. They are capable of recognizing potential dangers when these are explained to them in a clear and appropriate manner. A is incorrect. School-age children often become more adventurous as they gain independence and are influenced by peers. They are more likely to take risks than preschoolers. B is incorrect. Most injuries in school-age children occur in or near the home, so they are not necessarily safest when at home. Supervision and a safe environment are essential for preventing accidents. D is incorrect. School-aged children generally have better self-control than preschoolers due to their cognitive and emotional development. This genital examination positioning question has appeared 4 times in the past 5 years, so there is a good chance it will appear in the exam again. The nurse is preparing a client for a genital examination. Which position should the nurse assist the client into? A. Semi-fowlers. B. Supine with knees bent. C. Prone with knees bent. D. Semilithotomy. The correct answer is D. Semilithotomy. D is correct. The semilithotomy position is the standard position for genital examinations. It involves the client lying on their back with knees bent and feet in stirrups, allowing optimal access to the genital area while maintaining patient comfort. A is incorrect. The semi-Fowler's position is typically used for assessments of the lungs or heart and is not suitable for genital examinations. B is incorrect. Although the supine position with knees bent is comfortable, it does not provide adequate access for a genital examination. C is incorrect. Prone positioning is inappropriate for genital exams, as it does not allow access to the necessary area. This anemia-related question has appeared 6 times in the last 5 years and may come up in your exam again. A client with anemia and occult blood in the stool is prescribed medications. Which medication should the nurse question? A. Iron sucrose. B. Enoxaparin. C. Sucralfate. D. Hydroxyurea. The correct answer is B. Enoxaparin. B is correct. Enoxaparin is an anticoagulant that increases the risk of bleeding. Since the client has occult blood in the stool, indicating gastrointestinal bleeding, enoxaparin is contraindicated due to the increased risk of worsening the bleeding. A is incorrect. Iron sucrose is used to treat anemia caused by iron deficiency and would be appropriate for this client. C is incorrect. Sucralfate is a gastric mucosa protectant, which can be helpful in preventing further gastrointestinal injury. It would not need to be questioned. D is incorrect. Hydroxyurea is used for managing conditions like sickle cell anemia or certain cancers and is not contraindicated in clients with gastrointestinal bleeding. This oxygen safety-related question has been asked 5 times in the last 5 years and is quite likely to show up in the exam. A nurse is preparing to transport a client who requires oxygen. What is the nurse's first action to ensure safe use of the portable oxygen cylinder? A. Check the amount of oxygen in the cylinder before using it. B. Use a cylinder with 500 psi of oxygen for the transfer. C. Place the oxygen cylinder on the stretcher next to the client. D. Turn the cylinder key counterclockwise to stop oxygen flow. The correct answer is A. Check the amount of oxygen in the cylinder before using it. A is correct. The nurse's first action should always be to check the amount of oxygen in the portable cylinder before transporting a client. This ensures that there is enough oxygen available for the entire transfer, preventing any interruptions in oxygen supply. B is incorrect. A cylinder with only 500 psi of oxygen is considered too low for safe use, as it may not provide enough oxygen during the transfer. The cylinder should have more than 500 psi. C is incorrect. The oxygen cylinder must be properly secured to prevent it from rolling or falling during the transfer, as an unsecured cylinder can pose a safety hazard. D is incorrect. The cylinder key should be turned clockwise to stop the oxygen flow, not counterclockwise. This peritonitis-related question has been asked 4 times in the last 5 years and could likely show up in the exam. The nurse is caring for a client diagnosed with peritonitis. Which medication should the nurse anticipate being prescribed? A. Pantoprazole. B. Ciprofloxacin. C. Lactulose. D. Loperamide. The correct answer is B. Ciprofloxacin. B is correct. Ciprofloxacin is an antibiotic used to treat intra-abdominal infections like peritonitis. The nurse should anticipate this medication being prescribed to combat the infection. A is incorrect. Pantoprazole is a proton pump inhibitor used to reduce stomach acid and treat conditions like gastroesophageal reflux disease, GERD, but it is not relevant for treating peritonitis. C is incorrect. Lactulose is used to reduce ammonia levels in clients with hepatic encephalopathy and is not appropriate for treating peritonitis. D is incorrect. Loperamide is an antidiarrheal medication and is not indicated for the treatment of peritonitis, which requires antibiotics. This pediatric otitis media question has appeared 5 times in the last 5 years and is likely to appear again in your exam. A 1-year-old client diagnosed with acute otitis media is experiencing fever and ear pain. What is the nurse's priority intervention? A. Position the child on their left side. B. Administer antibiotic ear drops. C. Administer acetaminophen as prescribed. D. Apply a heat pack to the left ear. The correct answer is C. Administer acetaminophen as prescribed. C is correct. The child has been febrile for 24 hours and is experiencing otalgia, ear pain. Administering acetaminophen as prescribed is the priority action to reduce the fever and alleviate discomfort. A is incorrect. Positioning the child on their left side may help with drainage, but does not address the child's fever or pain, which are the priority concerns. B is incorrect. Systemic antibiotics are used for treating otitis media, not eardrops. Eardrops are not effective for treating the middle ear infection in this case. D is incorrect. Applying a heat pack can help relieve pain, but since the child is febrile, antipyretics like acetaminophen are the priority to lower the fever. Let's move to the next question. This alcohol withdrawal-related safety question has been asked 5 times in the last 5 years and is likely to appear again in your exam. A 30-year-old patient arrives at the emergency department after experiencing alcohol withdrawal-related seizures. The psychiatric nurse knows that the patient will soon be transferred to a non-medical psychiatric care unit. What action should the nurse prioritize to ensure the patient's safety? A. Request a prescription for clonazepam, which may help alleviate a withdrawal symptoms. B. Make sure an intravenous pump is properly set up at the patient's bedside. C. Order an immediate arterial blood gas, ABG, test. D. Ensure that the bed's side rails are padded to prevent injury during possible seizures. The correct answer is D. Ensure that the bed's side rails are padded to prevent injury during possible seizures. D is correct because since this patient is experiencing seizures due to alcohol withdrawal, the most important action is to protect them from injury, particularly if further seizures occur. Padding the side rails is essential to reduce the risk of harm during convulsions. A is incorrect because clonazepam may alleviate anxiety and alcohol withdrawal, but benzodiazepines like lorazepam, diazepam, or chlordiazepoxide are typically more effective and are the first-line treatment. B is incorrect because the patient is being admitted to a psychiatric unit, where continuous intravenous infusions are not typically allowed. C is incorrect because ordering a stat ABG is not warranted unless the patient presents with specific respiratory issues or acid-base imbalances. Let's continue with the next question. This delegation-related question has been asked 4 times in the last 5 years and may likely reappear in your exam. A registered nurse, RN, is working with a licensed practical GESU vocational nurse, LPNVN, in a behavioral health unit. Which of the following tasks is appropriate for the RN to delegate to the LPNVN? A. Conduct an alcohol withdrawal screening for a client undergoing detoxification. B. Administer medication to a client via a nasogastric tube. C. Perform a suicide risk assessment on a newly admitted client. D. Provide education to a client about a newly prescribed antidepressant, citalopram. The correct answer is B. Administer medication to a client via a nasogastric tube. B is correct because administering medications through a nasogastric tube is within the scope of practice for an LPN-VN. The RN can delegate this task because it involves routine administration of medications, not complex clinical judgment. A is incorrect because screening a client for alcohol withdrawal involves critical assessment skills and requires clinical judgment, which must be performed by the RN. C is incorrect because suicide risk assessment is an important and sensitive clinical task that requires an RN's judgment to determine the level of risk and appropriate interventions. D is incorrect because educating a client on newly prescribed medications requires the RN's expertise to explain potential side effects, dosing, and therapeutic effects. Let's move to the next question. This osteoporosis medication-related question has been asked 3 times over the past 5 years, so it's important to be prepared for it. The nurse is preparing to administer alendronate to a patient diagnosed with osteoporosis. The nurse should inform the patient that the primary goal of this medication is to A. Reduce inflammation in the bones, B. Increase the amount of fluid in the joints, C. Prevent the breakdown of bone tissue, D. Raise calcium levels in the blood. The correct answer is C. Prevent the breakdown of bone tissue. C is correct because alendronate is a bisphosphonate, which works by inhibiting the activity of osteoclasts, the cells responsible for bone resorption. This medication helps reduce bone loss, increases bone density, and lowers the risk of fractures in individuals with osteoporosis. A is incorrect because alendronate does not act as an anti-inflammatory medication, and osteoporosis is not primarily an inflammatory condition. B is incorrect because bisphosphonates do not affect synovial fluid levels in the joints. D is incorrect because alendronate does not work by increasing serum calcium levels. Its focus is on preventing bone degradation. Let's proceed to the next question. This assessment technique question has appeared 6 times in the last 5 years, so you're likely to encounter it in the exam. During a physical assessment, the nurse needs to evaluate tactile fremitus on an adult patient. How should the nurse correctly perform this assessment? A. Place the thumbs on either side of the patient's spine at the level of the 9th ribs. B. Instruct the patient to breathe deeply through an open mouth while the nurse listens to lung sounds. C. Ask the patient to repeat the phrase 99 while palpating the spaces between the ribs, starting at the top of the lungs. D. Tap the patient's chest over the finger positioned on the distal interphalangeal joint using the other hand's middle finger. The correct answer is C. Ask the patient to repeat the phrase 99 while palpating the spaces between the ribs, starting at the top of the lungs. C is correct because to assess tactile fremitus, the nurse should palpate the patient's chest while the patient says 99. The nurse then compares the vibrations felt on both sides of the chest. Abnormalities in fremitus, such as increased or decreased vibrations, could indicate conditions like pneumothorax or fluid accumulation in the lungs. A is incorrect because placing the thumbs at the level of the 9th ribs and assessing for expansion is used to evaluate lung expansion, not tactile fremitus. B is incorrect because deep breathing through an open mouth is part of lung auscultation, not tactile fremitus assessment. D is incorrect because tapping the chest to assess resonance is known as percussion, not tactile fremitus. Let's move on to the next question. This mental health communication question has been asked 4 times in the past 5 years, making it moderately likely to appear in the exam. While assessing a patient, the nurse hears the patient say, "You are part of a conspiracy by the government to harm me." What would be the most appropriate response from the nurse? A. Would it be better if I come back later for this assessment? B. I understand how you feel, and we can explore this together. C. Can you share more details about who is trying to harm you? D. Let's focus on discussing your medications and how they can help with your current thoughts. The correct answer is C. Can you share more details about who is trying to harm you? C is correct, because the nurse should explore the content of the patient's delusion to better understand the patient's thought process and establish a therapeutic relationship. Engaging the patient in this manner helps build rapport and allows the nurse to assess the severity and risk associated with the delusion. AI is incorrect because avoiding or postponing the conversation is not therapeutic and could lead to further distress or mistrust. B is incorrect because while it's important to validate the patient's feelings, agreeing with the delusion is not therapeutic and may reinforce false beliefs. D is incorrect because immediately shifting the focus to medication may shut down communication and prevent the patient from expressing their feelings fully. Let's continue to the next question. This vitamin deficiency assessment question has appeared 5 times in the past 5 years and is often repeated in exams. At a community health event, the nurse is assessing various individuals for potential vitamin deficiencies. Which client is at the greatest risk for folate deficiency? A. A resident of a long-term care facility. B. An individual with developmental delays. C. A young woman who recently started menstruating. D. A client with chronic alcoholism. The correct answer is D. A client with chronic alcoholism. D is correct because chronic alcohol use is a major risk factor for folate deficiency, as alcohol interferes with the absorption and metabolism of folic acid, vitamin B9. This deficiency is common in individuals with alcohol use disorder and can lead to serious health issues, including anemia and neurological problems. A is incorrect because, although some residents of long-term care facilities may have nutritional deficiencies, it is not specifically linked to folate deficiency unless other risk factors are present. B is incorrect because developmental delay is not directly associated with folate deficiency. C is incorrect because starting menstruation is not a significant risk factor for folate deficiency. Let's move to the next question. This obstetric complication-related question has appeared 7 times in the last 5 years, making it highly likely to come up in your exam. The nurse is caring for a patient diagnosed with placenta previa. Which order from the primary healthcare provider, PHCP, should the nurse question? A. Perform a manual cervical exam. B. Schedule a transabdominal ultrasound. C. Conduct a non-stress test. D. Arrange for a transvaginal ultrasound. The correct answer is A. Perform a manual cervical exam. A is correct because a manual cervical exam should not be performed on a patient with placenta previa, as it can cause severe bleeding by disrupting the placenta. The nurse should question this order and seek alternative ways to assess the cervix or placental location safely. B is incorrect because a transabdominal ultrasound is a non-invasive and safe way to assess the location of the placenta in cases of placenta previa. C is incorrect because a non-stress test is a routine and safe procedure to monitor fetal well-being and is not contraindicated in placenta previa. D is incorrect because a transvaginal ultrasound is also a safe diagnostic tool for evaluating the placental position and is considered more accurate than abdominal ultrasound in some cases. Let's move on to the next question. This anemia-related question has been asked 6 times over the past 5 years, so it's important to review it. A patient's hemoglobin level is reported as 10 gram per deciliter. What should be the nurse's top priority goal for this patient? A. Promote physical activity. B. Support skin integrity. C. Prevent constipation. D. Help the patient conserve energy. The correct answer is D. Help the patient conserve energy. D is correct because a hemoglobin level of 10 gram per deciliter indicates mild anemia, which means the patient's body may not be able to transport sufficient oxygen to tissues, leading to fatigue. The primary goal should be to help the patient conserve energy to prevent excessive oxygen demand and alleviate fatigue. A is incorrect because increased activity can lead to oxygen depletion and further fatigue in an anemic patient. B is incorrect because maintaining skin integrity is important, but not the highest priority for this patient's condition. C is incorrect because constipation management is a secondary concern compared to the need to conserve energy in the case of anemia. Let's move to the next question. This swallowing assessment question has been asked 4 times in the past 5 years, so it may appear in your exam. A nurse is conducting a swallowing assessment on a patient who was recently extubated. Which of the following findings would require immediate intervention? A. A mild cough after drinking a small amount of water. B. Hoarseness when speaking after extubation. C. Mild throat pain when swallowing. D. A wet, gurgling cough after drinking water. The correct answer is D. A wet, gurgling cough after drinking water. D is correct because a wet, gurgling cough is an indication of possible aspiration, which can occur when food or liquids enter the airway instead of the esophagus. This is a critical finding that requires the nurse to stop any oral intake and notify the healthcare provider, as aspiration can lead to serious complications like pneumonia. A is incorrect because a slight cough is not uncommon after extubation and may not require immediate intervention unless it persists or worsens. B is incorrect because hoarseness is expected after extubation due to irritation of the vocal cords and typically resolves over time. C is incorrect because mild throat discomfort is a common symptom after extubation and does not necessarily require immediate action. Let's move on to the final question. This pregnancy-related question has been asked 3 times in the past 5 years and is moderately likely to appear in the exam. A nurse is interviewing a patient who reports frequent urination and nausea. The patient believes she may be pregnant. The nurse recognizes that these symptoms are considered A. Possible signs of pregnancy. B. Probable signs of pregnancy. C. Positive signs of pregnancy. D. Presumptive signs of pregnancy. The correct answer is D. Presumptive signs of pregnancy. D is correct because frequent urination and nausea are classified as presumptive signs of pregnancy, meaning they are symptoms reported by the patient that may suggest pregnancy but are not definitive. These signs could be caused by other conditions and require further evaluation. A is incorrect because the term possible is not typically used in the classification of pregnancy signs. B is incorrect because probable signs are objective findings observed by a healthcare provider, such as a positive pregnancy test or changes in the uterus. C is incorrect because positive signs of pregnancy are those that provide direct evidence of a fetus, such as hearing a fetal heartbeat or visualizing the fetus on an ultrasound. This trazodone-related question has been asked 6 times in the last 5 years, making it moderately likely to appear in your exam. A nurse is monitoring a patient who is taking trazodone. Which symptom would suggest the patient is experiencing an adverse reaction? A. Dizziness. B. Sedation. C. Priapism. D. Dry mouth. The correct answer is C. Priapism. C is correct because trazodone can cause a rare but serious side effect known as priapism, which is a prolonged painful erection that lasts more than 4 hours. This condition requires immediate medical attention, as it can lead to tissue damage or permanent erectile dysfunction due to reduced blood flow. A is incorrect because dizziness is a common side effect of trazodone, especially when first starting the medication. While it may affect daily activities, it is not considered a dangerous adverse effect. B is incorrect because sedation is a therapeutic effect of trazodone, particularly when used to treat insomnia. It is not an indication of an adverse reaction, but rather an expected outcome. D is incorrect because dry mouth is a mild, common side effect of trazodone and many other medications. It is generally not harmful and can be managed with simple remedies like hydration or sugarless gum. This IBS-related question has been asked 5 times over the last 5 years, making it fairly likely to appear in the exam. A nurse is assessing a newly diagnosed patient with irritable bowel syndrome, IBS. What finding is typical of this condition? A. Unexplained weight loss. B. Epigastric pain and nausea. C. Alternating constipation and diarrhea. D. Low-grade fever and fatigue. The correct answer is C. Alternating constipation and diarrhea. C is correct because alternating constipation and diarrhea is the hallmark symptom of IBS. This condition affects the large intestine and results in changes to bowel habits, often accompanied by abdominal pain or cramping, but without serious underlying pathology. A is incorrect because unexplained weight loss is not associated with IBS. If a patient has significant weight loss, it suggests a more serious gastrointestinal condition, such as cancer or inflammatory bowel disease, and should be investigated further. B is incorrect because epigastric pain and nausea are more typical of conditions like gastritis or peptic ulcers. IBS symptoms generally involve the lower abdomen and do not frequently cause upper gastrointestinal issues. D is incorrect because IBS is not an inflammatory or infectious condition, so fever and systemic symptoms like fatigue are uncommon. These symptoms suggest another condition, such as infection or autoimmune disease. This haloperidol-related question has been asked 8 times in the last 5 years, making it highly likely to appear in your exam. A nurse is preparing to administer haloperidol to a patient. What condition is this medication typically prescribed for? A. Dementia. B. Schizophrenia. C. Major depressive disorder. D. Bipolar disorder. The correct answer is B. Schizophrenia. B is correct because haloperidol is a first-generation antipsychotic used primarily in the treatment of schizophrenia. It helps manage symptoms like hallucinations, delusions, and disorganized thinking, but it also carries a risk of side effects such as extrapyramidal symptoms, EPS, including muscle rigidity, tremors, and tardive dyskinesia. A is incorrect because haloperidol is not used to treat dementia, especially given its risk for worsening confusion or causing sedation in older adults. Antipsychotics are sometimes used off-label to manage severe agitation in dementia, but this is not a primary use. C is incorrect because major depressive disorder is treated with antidepressants like SSRIs or SNRIs, not antipsychotics like haloperidol, unless there are psychotic features. D is incorrect because bipolar disorder is usually managed with mood stabilizers, e.g., lithium or valproate, or atypical antipsychotics, which have a broader spectrum of action than haloperidol. This INH-related question has been asked 7 times in the past 5 years, making it likely to come up in the exam. A nurse is educating a patient newly prescribed isoniazid, INH, for tuberculosis. Which patient statement requires follow-up? A. I will take this medication for 3 months. B. I will need regular blood tests to check for side effects. C. I am no longer contagious after 3 negative sputum samples. D. This medication may cause numbness in my hands and feet. The correct answer is A. I will take this medication for 3 months. A is correct because this statement requires follow-up as it is inaccurate. Tuberculosis treatment with INH typically lasts 6 to 9 months. Shorter treatment courses could lead to incomplete eradication of the infection and increase the risk of drug resistance. B is incorrect because regular blood tests are necessary while taking INH because it can cause liver damage and blood abnormalities. This statement reflects proper understanding. C is incorrect because a patient with tuberculosis is considered non-infectious after 3 consecutive negative sputum cultures for acid-fast bacilli. D is incorrect because INH can cause peripheral neuropathy, leading to numbness or tingling in the extremities, especially in patients with pre-existing conditions like diabetes. This side effect can be managed with vitamin B6 pyridoxine supplementation. This SSRI-related question has been asked 6 times over the last 5 years, making it moderately likely to appear in the exam. A nurse is caring for a patient with generalized anxiety disorder, GAD, and anticipates that the physician will prescribe an SSRI. Which medication is classified as an SSRI? A. Venlafaxine. B. Paroxetine. C. Alprazolam. D. Duloxetine. The correct answer is B. Paroxetine. B is correct because paroxetine is an SSRI, which is commonly prescribed for anxiety disorders, including GAD, social anxiety disorder, and panic disorder. It increases serotonin levels in the brain, helping to alleviate symptoms of anxiety over time, though it may take 6 to 8 weeks to see full therapeutic effects. A is incorrect because venlafaxine is not an SSRI. It is a serotonin norepinephrine reuptake inhibitor, SNRI, used for both depression and anxiety disorders. C is incorrect because alprazolam is a benzodiazepine, not an SSRI. It is used for short-term management of anxiety, but carries a higher risk of dependency and withdrawal symptoms. D is incorrect because duloxetine is an SNRI, not an SSRI, and is used for treating depression, anxiety, and certain types of chronic pain. This EVD management-related question has been asked 9 times in the past 5 years, making it highly likely to appear in your exam. A nurse is managing a patient with an external ventricular drain, EVD, due to a traumatic brain injury. What is a crucial action for the nurse when repositioning the patient? A. Elevate the drainage bag above the level of the head. B. Flush the EVD tubing with normal saline every 4 hours. C. Monitor the intracranial pressure, ICP, waveform periodically. Declamp the EVD before repositioning the patient. The correct answer is D. Clamp the EVD before repositioning the patient. D is correct because the nurse must clamp the EVD before repositioning the patient to prevent rapid fluctuations in cerebrospinal fluid, CSF drainage, and changes in intracranial pressure. Uncontrolled drainage can result in serious complications, such as brain herniation or subdural hematoma. A is incorrect because the EVD drainage bag should be kept level with the patient's external auditory meatus, or as prescribed, but never elevated above the head, as this can impede drainage and increase intracranial pressure. B is incorrect because flushing the EVD tubing is not part of standard care. This could introduce infection or air into the system, which could lead to serious complications. C is incorrect because while monitoring the ICP waveform is important, it is not directly related to the action of repositioning the patient. The priority is to prevent rapid shifts in CSF levels by clamping the drain. This HIV treatment-related question has been asked 5 times in the last 5 years, making it fairly likely to appear in the exam. A nurse receives a prescription for tenofovir and emtricitabine for a patient. What condition is this medication used to treat? A. Multiple sclerosis. B. HIV infection. C. Parkinson's disease. D. Guillain-Barré syndrome. The correct answer is B. HIV infection. B is correct because tenofovir and emtricitabine are antiretroviral medications used in the prevention and treatment of HIV infection. They work by inhibiting reverse transcriptase, an enzyme necessary for HIV replication, thereby reducing the viral load and slowing disease progression. A is incorrect because multiple sclerosis is treated with immunomodulatory drugs, such as interferon or disease-modifying therapies, not antiretrovirals. C is incorrect because Parkinson's disease is treated with medications that increase dopamine levels, such as levodopa, not tenofovir, and emtricitabine. D is incorrect because Guillain-Barré syndrome is typically managed with intravenous immunoglobulin, EVIG, or plasmapheresis, not antiretrovirals. This vitamin D deficiency-related question has been asked 4 times in the past 5 years, making it moderately likely to appear in your exam. A pregnant client of Middle Eastern descent typically wears a robe that covers most of her body and a shawl over her head. Based on this information, what supplement is the nurse most likely to anticipate for this client? A. Vitamin D. B. Vitamin C. C. Calcium. D. Zinc. The correct answer is A. Vitamin D. A is correct because due to reduced sun exposure from traditional attire, clients who cover most of their skin are at higher risk for vitamin D deficiency, which can affect bone health in both the mother and the developing fetus. Supplementation with vitamin D is often recommended to ensure adequate levels. B is incorrect because there is no direct correlation between wearing traditional attire and vitamin C deficiency, as vitamin C can be obtained from the diet. C is incorrect because while calcium is important during pregnancy, there is no specific link between traditional attire and calcium deficiency. D is incorrect because zinc deficiency is not associated with wearing traditional attire, and zinc needs are typically met through diet or multivitamins during pregnancy. This DKA-related question has been asked 7 times in the last 5 years, making it likely to show up in your exam. A patient with diabetic ketoacidosis, DKA, is receiving intravenous regular insulin, and their potassium level is 2.9 mEq/Gel. What action should the nurse take first? A. Notify the healthcare provider. B. Stop the regular insulin infusion. C. Obtain a 12-lead electrocardiogram, ECG. D. Assess the patient's urine output. The correct answer is B. Stop the regular insulin infusion. B is correct because insulin lowers potassium levels by driving potassium into cells, which can worsen hypokalemia. Since the patient's potassium is already critically low, 2.9 mEq/L, continuing the insulin infusion could lead to life-threatening complications such as cardiac arrhythmias. The infusion should be stopped until potassium levels are corrected. A is incorrect because while notifying the healthcare provider is important, the immediate priority is to stop the insulin to prevent further potassium loss. C is incorrect because an ECG is useful for assessing the effects of hypokalemia on the heart, but stopping the insulin infusion is a more urgent action. D is incorrect because urine output is important to monitor in DKA, but it is not the priority in this situation, where hypokalemia must be addressed immediately. This aspirin-related question has been asked 5 times in the past 5 years, making it fairly likely to appear in your exam. A patient taking aspirin reports a new symptom. Which finding indicates a serious adverse effect of aspirin? A. Polyuria. B. Hypokalemia. C. Venous thromboembolism. D. Black, tarry stools. The correct answer is D. Black, tarry stools. D is correct because black tarry stools indicate gastrointestinal bleeding, a serious adverse effect of aspirin, which can cause gastric irritation, ulcers, and bleeding due to its antiplatelet effects. This requires prompt evaluation and possible discontinuation of the drug. AI is incorrect because polyuria, increased urination, is not a typical side effect of aspirin and would more likely be associated with conditions like diabetes or diuretic use. B is incorrect because hypokalemia is not linked to aspirin use. It is more commonly seen with diuretic use or conditions like vomiting or diarrhea. C is incorrect because venous thromboembolism, VTE, is unlikely with aspirin, which is an antiplatelet agent designed to reduce the risk of blood clots, not increase it.